honor of National Vascular Day. My name is Meher Jasia. I am physiotherapist, clinical supervisor of physiotherapy at PRS Neuro Rehab Center. This year, the Vascular Society of India has aptly chosen the theme Amputation Free India. This theme underscores the critical importance of early detection, timely intervention, and comprehensive care in preventing limb amputations resulting from vascular diseases. To begin this meaningful occasion, let us embrace a tradition that symbolizes the dispelling of darkness through knowledge and the spreading of light through awareness, a ceremonial lamplighting. I now invite Dr. Suresh K.R., Dr. Vivekanand, Dr. Sharan Srinivas, Dr. Sumant to the stage, Dr. Nikhil to the stage. To, please step forward and light the lamp. Everybody, please stand up for the prayer. Thank you, everyone. Now, ladies and gentlemen, I am truly honored to introduce a visionary leader right here within our institution, Dr. K.R. Suresh, Director and Senior Consultant in Vascular Surgery at the Jain Institute of Vascular Sciences, Bhagavan Mahavir Jain Hospital. With over 4 decades of experience and a distinguished educational journey, Dr. Suresh has been instrumental in elevating vascular care in our region. It's with profound respect and admiration that I now invite him to the stage to share his insights. Please join me in extending a warm and heartfelt welcome to Dr. K.R. Suresh. Yes, sir.
Yeah, that's great. Good morning. I think it is. Thank you, Sharon. And I'm not sure what I'm supposed to say, but I'll say a few things as a vascular surgeon. Now, you're talking about amputation free India. That's a utopian dream. It's never going to happen. World is never going to be without amputation. Every 8 minutes there's amputation taken in this world. How many amputations take? This is purely about diabetic. I'm not talking about trauma, etc., etc. So you're talking about one amputation every 8 minutes in the world. Now, in India, who knows the number? The thrown number around is just like 2 lakh, 3 lakhs, 4 lakhs. Take your pick. And that's correct. People lose leg, hugely leg. Now, before the loss of leg was diabetic was due to mines. You know what the mines are? Left on the battlefield. That was incredibly bad at that time. Actually, I'm very proud to say 25 years back, Princess Diana was in charge of the mines, and she had asked one of the colleagues, and we wrote how diabetes is overtaking amputation mines. You step on the mines, which left over by Second World War and other wars. They will lose the leg. So amputation now is a really a problem of diabetes. Why is amputation-free India never been? It's a utopian dream. You will never achieve it, but there's no question you're doing for it. Whether you achieve it or not, your aim is more important. How you get there is very difficult. Now in India, the vascular surgery is still unknown compared to before. It was like a nomad for 20, 30 years back when he came. It was like John Bunyan's, you know the book, Pilgrim's Progress. He's a nomad walking around, he becomes unknown, then eventually, he's hampered by other people like cardiovascular surgery, cardiology, etc. But he does attain a presence eventually. His name is Christian. So vascular surgery come a long way. Now why is we stress on amputation? When you do vascular surgery, you're a vascular specialist, the whole body is covered except the heart and the brain, but 50-60% were in the leg. Mostly because in India especially we deal mostly with diabetics. In our own data we have 70-80% diabetics when you do reconstruction. And barefoot walking, injury, and neuropathy, lack of sleep. That's the reason for amputation. How do you prevent an amputation? The first thing is never forget a footwear. People lose the leg because they don't sensation. It's called loss of protective sensation. So that is the prime cause, not necessarily vascular disease. You add a quotient of vascular disease into the plethora of diseases. It's a good recipe for amputation. The infection is very robust in India. Robust is not the correct word, very rampant, because we live in a contaminated society. Walk barefoot. That's DNA to walk in barefoot. Nobody likes to wear footwear. So first thing in the amputation prevention is not vascular surgery. It is prevention of wound. 80% diabetics who undergo amputation have an ulcer prior to an amputation, which is caused by barefoot walking. If you don't get an ulcer, you won't have an amputation, irrespective of how much block you have. And then prevention is a multimodality program. It's not just one person. There's no way in the world one person can ever do that. It's a team. See, vascular surgery is the only holistic field now, which is complete. We do vascular medicine, with diabetic foot, and then of course surgery and vascular procedure. The combination of all this. Remember, to prevent an amputation, 80% don't really require any intervention, even if you have blocked arteries. Prevent a wound, you don't need vascular surgery, you don't need intervention, you don't need the complications of vascular surgery. Now, why should you prevent amputation? Big deal, take the leg off. That's the common in India. Even in big centers, they say, to amputation, they chop the leg off. It's okay. So remember, in the world, there are about 10 diseases which are assigned as horrible 5-year survival rate. The first is pancreatic. This is, my people know, I've heard it a million times. The first is pancreatic cancer. Next is lung cancer. They haven't changed the position number 1, 2, way with the worst 5-year survival. If you ask, what is the third? Is the heart attack? How many say heart attack? Raise your hands. Don't be shy. Okay. Vivek, shame on you.
I thought we would bring some.
Come on. I know. Be honest. Cancer? How many raise your hands? What is this? You have raising hands for everything. No. Third is amputation. Why is that they die? I'm talking about diabetic, not a trauma amputation. They're young, healthy people. So why do they die? When you have blood vessel disease in the leg is the mirror of the body. Call of the other country. You have in the leg, 70% have everywhere in the body. That means that even if they don't have symptoms, they're more prone for heart attack and stroke in future. You amputate. What happens when you walk? Your pulse goes up, right? That's the whole purpose of walking. Imagine you walk with a weight on your head. Your pulse goes higher. So an amputation, this comes from the West where the beautiful legs, the microprocessor best expensive, they can run with that. Even if that, in 2 years, 40% suffer a cardiac event. Because you're increasing your heart rate with every step. Try to brush your teeth with standing on one leg and check your pulse. It doubles virtually. So imagine an amputee trying to walk with a Jaipur leg, which is not a bad leg, but it's not a functional leg. Even then, 40% develop cardiac disease, and third worst is amputation because increased cardiac risk. They die of heart attack. Then comes what's called short-cuts foot. Short-cuts foot is abnormal neuropathic foot, which is out of shape foot, and then that's the fourth one which causes the death rate. Higher than, except pancreatic and lung cancer, higher than any cancer. Remember that before you amputate. So first thing is prevent an ulcer, footwear. Good footwear and hygiene, foot hygiene. You prevent an ulcer, you prevent an amputation. That's the goal. It's a utopian dream to have no amputation. Not going to happen in the world. There will be amputations for various reasons, but cut it down. Cut it down on a function of people. With that, I can stop there. Thank you.
That was an enlightening and helpful session we have just experienced. A huge thank you to Dr. K.R. Suresh for sharing such insights. Thank you, sir. Now, I invite Dr. Sumant Raj, Senior Vascular Consultant, to share some insights. Please join me in welcoming him. Dr. Sumant Raj, please.
Good morning, everyone. I'm really confused. Oh. ಇಲ್ಲ, power cut. So even power doesn't want me to talk.
Just a second.
Can I continue? I'm audible, I believe. Audible. So I'm really confused. I don't know what Sharan wants me to talk about amputation free or a vascular day or about department. Anything. So,
Vascular and the department.
see,
You got the answer.
I will talk about department. So this department was Jain Institute of Vascular Science, was established in Jain Hospital in 1999, I believe, I am right. 1999-2000, with Dr. Suresh. He is a founder of this department, along with Dr. Vivekanand. And of course, other people like Vinya and all. I joined department in 2002 as I'm from a small place, new, not even able to talk a good English, and my surgery training was good. So we have reached places. I think the amount of education, amount of what do you say, the awareness among other doctors or among other places, the effort taken by Dr. Suresh and Vivek is very good. That's why the department is growing year on year, and of course support received from hospital trustees also is excellent. Not to even our anesthetist Dr. Sudhakar, not to forget about him, because he is also one of the stakeholder in improving the care to the patient. So finally, all we try is to give the care to the patient. So with this, I end my talk, and really privileged to attend this session because two of my mentors, one Dr. Suresh and Vivek, I am really grateful to them. Thank you.
Thank you, sir. Now, I'm excited to introduce you to something truly special, Rebooting the Brain, a platform dedicated to explore diverse topics that matters to all of us. This podcast is more than just conversations. It's a journey into stories that inspire, inform, and challenge perceptions. Each episode shines a spotlight on unique themes ranging from health and wellness to advocacy and personal growth. Today, we are proud to feature an episode of Rebooting the Brain. Dr. Sharan Srinivasan engages in a conversation with Dr. Vivekanand, a leading vascular and endovascular surgeon and the current president of Vascular Society of India. He leads JIVAS, the Jain Institute of Vascular Sciences at Bhagavan Mahavir Jain Hospital, Bangalore, an institution that has quietly earned a reputation as one of the nation's most trusted centers for vascular care. Dr. Vivekanand and Dr. Sharan Srinivasan on the mission for an amputation-free India, a vision where awareness, early diagnosis and a timely vascular care saves lives and limbs. This is not just a medical discussion, it is a call to protect mobility, dignity and quality of life for every individual. It is an invaluable resource for anyone seeking knowledge on this important topic. But this is just one of many impactful stories the podcast explores. Whether it's health, resilience, or stories of innovation, Rebooting the Brain is your go to destination for thought provoking conversations. So, now let's take a moment to listen to the promo for the special episode on Vascular Day. I'm confident it will leave you inspired and eager to tune into more episodes. Let's watch the podcast promo.
Don't listen to the doctors. What is vascular surgery? And this is one of those conditions about one of the few conditions which can easily be avoided. Vascular patients are some of the most morbid patients. Sudden death in the post-operative period is usually a pulmonary embolism unprovoked otherwise. Different people from different levels you have in the organization, but working like a well-oiled machine. India has the highest concentration or highest population of diabetics in the world now. Yes, we've overtaken China there too. The second most leading cause of death in a post-pituitarian stage is again deep vein thrombosis with pulmonary embolism. We've already placed the order and we're getting delivery of the latest cath lab, which is really high end. Surgery is not the solution, it's just a part of the solution. A sword is a sword and nothing can beat a samurai sword. A country of our size has around, at the moment, around 600 odd active vascular surgeons. We make above 55 if you're doing all this. So it is foolish. Seeking attention only after it starts smelling. By that time it's rotten. That means over 2 weeks of infection has happened. It starts becoming putrid. The thing I would like to talk about is prevent diabetic foot infections. How we die is we all die because of atherosclerosis affecting different parts of the body. It's not how old we become. It's how old the arteries are. How important is exercise in the early stages? I mean, like, and what kind of exercise? We have two sets of exercises, one for the arterial system and the other for the venous system. Being in a trust-based hospital, you're able to reach out to a lot more sections of the society or strata of the society than when you're in a corporate hospital. You just look at me and say, midlife crisis. I said, maybe. Do you encourage people to do massage for the pain and all those things when the DVT is there? Youngsters pop in the morning after pill extremely frequent, and they come to the clinic or to the outpatients with a swollen limb. And then you think about this. I know we don't think about it. It's very difficult for us. We ask, and then we ask them, for a lady to be telling that she popped the pill in front of the parents or attendants is very difficult. Doctors tend to take a lot of credit, surgeons take a lot of credit. If nobody gives it, we should steal the credit. So the next big problem is varicose veins. It's okay, sir. It's okay.
Chalo, we'll make him launch it. Yes, sir. Come for him to launch. Yeah. Just take it up.
It's back.
Then we'll
10 seconds.